swerte po tayo. Now people are beginning to look into the business at dito po sa product natin and even medical professionals po. And we are fortunate po to have one here. He's a graduate po of BS Biology niya from UP Los Baños. He took up his medicine sa De La Salle University sa Dasmariñas po. Internship po at the AFP Medical Center. Please help me welcome po to give his testimony, Dr. Solier Mendoza.
Good morning po. I'm a practicing internist sa Laguna. Product of the product po. I was introduced to goji 6 months ago by my upline ay nag-visit, but katulad ng ibang doktor na nandito ngayon, nakatulad ko dati, skeptic, reluctant. Hindi kami naniniwala sa herbal yun. Kasi, alam nyo na, mariridicule ka ng kasama mo sa profession. Ganun ang Western medicine eh. Pills, IV injections, pills, IV injections, complications, coma, period. So, although pinag-aralan ko din because I was given materials and I looked it up at the internet, nakita ko nga maraming studies. So, after 6 months, so 3.5 weeks ago, dun pa lang ako nag-decide na mag-try yung product. So sabi ko, kailangan dinipig ko sarili ko ang muna. So I drank the product. Ang una kong naramdaman, well-rested sleep. Hindi namin nakukuha sa tatayag ko sa product. And then, I tried it on my patients. I am not here to have any medical claims, but I want to share my experience with my patients. I'm just here for 3.5 weeks. I have a 70-year-old patient, a diabetic on insulin. Range ng blood sugar niya, fasting blood sugar is 180 to 300. After 3.5 weeks of, well, yes, medications, conventional medications. But I added 2 G's sa regimen niya. And the latest na fasting blood sugar is 80, tatanggalin ko na siya sa insulin. Another is one patient who is also a diabetic, but diabetic at 37. Meron siyang mga fat deposits in his knuckles, darkening his neck na signify ng increase ng cholesterol sa katawan, hindi control ng blood sugar, umiihi 5 times a night, with oral medications ng anti-diabetic and cholesterol, but despite that, for about 1 to 2 years, ganun pa rin ang symptoms. Maybe because of erratic diet and for compliance with medications because he's relatively young. But after about 1 month of drinking goji, the blood sugar is 109, within the normal limits po. And my last and most difficult patient that I have handled po is my father. My father is the type of parent who has a son or a daughter who is a doctor, that you are a Filipino parent, you really don't believe in your son or daughter who is a doctor is telling not to do things that are not right, right? So he had a heart attack 2004. He has a blockade in his right circumflex, the coronary support that is feeding the right side of the heart. 80% po ang blockade doon. 80% stenosis. Sa left circumflex, left side pupunta sa likuran ng puso, 80% blockade din. Yung main coronary, left anterior descending, the main artery has 50% blockade. So he was advised coronary angioplasty, lalagyan ng stent. Para sa mga doktor dito na katulad ko, alam natin na more or or less, 1 million yun, tas rehab. Maraming doktor dito sa paligid. So, but my father's really hard-headed, so he still went on with eating salty and fatty food. So, 6 months ago, he had another bout of chest pain, so off we went to the hospital. By the way, he was on maximum medications with 2 kinds of antihypertensives. Maximum medication with statin that reduces your bad cholesterol. One that cleans your blood, or the antithrombotic maximum medications. And then he also has medications to relax the muscles of the coronaries, the beta blockers, which by the way also predisposes you to diabetes, according to the American Diabetes Association. And so he had another coronary angiogram with maximum medications. The stenosis was still 80% on the left and right circumflex, and 50% pa rin sa left anterior descending yung main. May chest pain, may dyspnea. Again, he was advised angioplasty. Again, he refused. And so what will I do? I said, Dad, inumin mo kaya ito? Ang sabi niya sa akin, anong kalokohan niya, hindi ginagawa mo. Doktor ka, nag-albularyo na yan. And so, sabi ko, wala namang mawala, i-try mo lang. Sabi, sige. He tried it. And sabi niya, ano bang lasa niya? Sabi ko, try mo lang. And I'm happy to announce that he has already consumed this 6th bottle. And now he is asymptomatic. He can climb stairs, 2 or 3 stories with no dyspnea, no chest pain, no difficulty breathing, no easy fatigability. And he sleeps well at night, no more snoring due to ischemia, sir. So, thank you very much, goji. Thank you, sir.